Breaking right now, Governor Baker is speaking on the coronavirus alongside local transportation and health officials. Let's listen in.
Well, good morning. As part of our administration's efforts to prepare for the coronavirus, we met with medical experts, first responders, school officials, local public health leaders, and other stakeholders. We discussed the Commonwealth's ongoing preparedness planning for the coronavirus and their respective institutions' ongoing plans as well. We brought these experts together for two reasons: to ensure everyone has the resources and the support that they need, and to learn what our leading healthcare experts are learning about the virus. We're fortunate that Massachusetts is home to world-renowned hospitals and leading healthcare experts. As a reminder, Massachusetts remains at low risk and has one confirmed case and one presumptive positive case, which was announced on Monday night. Our top priority continues to be the health and safety of our residents, and we continue to coordinate with the CDC and with other federal offices. To that end, we were informed last night that the CDC is issuing an updated travel health alert for all United States residents starting today. The new alert instructs travelers returning from countries with a level 3 alert, China, South Korea, Iran, and Italy, to stay home and monitor their health for 14 days after returning to the U.S. It also instructs travelers from countries with a level 2 alert, Japan, to monitor their health and limit their interactions with others for 14 days after they return to the U.S. The Department of Public Health here will have further guidance on these advisories for Massachusetts residents available on its website later today. In addition to coordinating with federal partners, we're working collaboratively with a wide range of partners here in Massachusetts to ensure that the Commonwealth remains prepared. Today's meeting was a productive conversation between officials from our administration and leaders from the Commonwealth's network of hospitals, first responder entities, local boards of health, long-term care providers, and educational institutions. The Department of Public Health and other state agencies have been coordinating with officials from these entities constantly over the last several weeks to ensure that we're doing everything we can to keep Massachusetts safe and prepared. There's an immense amount of planning and coordinating that goes into preparedness efforts. To name a few examples, some of which you heard about on Monday. DPH has provided clinical and infection control guidance for hospitals and healthcare systems, disseminated detailed public health guidance and recommendations to school superintendents and principals throughout the Commonwealth, and issued guidance to long-term care facilities, including nursing homes and rest homes. In addition, today I signed a supplemental budget that includes $95,000 for staff costs at the State Public Health Lab associated with the coronavirus. And yesterday, DPH also held a conference call with local colleges and universities about coronavirus. We understand there have been many questions and concerns about upcoming international travel for universities, like student abroad programs that require an immense amount of planning and investment for students and their families. With this in mind, due to the evolving situation, we are urging colleges, universities, and high schools to cancel upcoming organized international trips at this time. Taking this precaution will help protect both the students and the Commonwealth, as we are home to such a large number of colleges and universities. We have some folks here today from UMass Amherst who can speak more to how they're planned to address this. Today's meeting was another step to get all stakeholders together to exchange information and updates and make sure we're working together to be prepared. Our hospitals, long-term care facilities, schools, and public transportation entities all have critical roles to play. And our administration remains committed to serving as a resource for these entities who are on the front lines of these ongoing efforts. DPH continues to maintain its public website that includes resources and guidance for individuals, families, schools, local boards of health, clinicians, and other healthcare providers. And please continue to check the banner at the top of mass.gov for important updates as they become available. And we will continue to keep you informed on new information regarding the coronavirus. Again, I know that for many residents, all the talk about this public health threat can be stressful. I want everyone to know that we're doing everything we can to protect the people here in the Commonwealth. And I also want people to know that they can help protect against the spread themselves, as has been discussed many times before. Use common sense, practice good personal hygiene, and if you are sick, stay home. I'd now like to welcome Secretary